puisqu'au final, elle est faite sur la base d'ateliers de simulation.
Cette construction en 3 jours, moi je la trouve parfaite parce qu'on nous a vraiment amenés à réfléchir sur nos organisations à nous.
Au cours de la simulation en réel, vous ressentez ou bien vous mettez le doigt sur la difficulté pratique à faire bouger un patient d'un point A à un point B, à communiquer au milieu d'un incident majeur.
C'est un exercice qui doit être répété tout le temps pour que les gens se l'approprient.
Après la formation, ce qu'on a fait, on est revenu au Liban et on a commencé à faire la formation dans des petites équipes des hôpitaux du Liban pour qu'eux-mêmes ils donnent la formation à d'autres gens dans les hôpitaux. Et alors, on est arrivé à un point maintenant que la majorité des hôpitaux, peut-être 90% des hôpitaux du Liban, ont eu la formation du MCM Training et le feedback était très positif.
Buenos días, buenas tardes a todos los presentes. Mi nombre es Isabel Duré, soy consultora internacional de la OMS para el campo virtual. Tengo la responsabilidad de moderar esta actividad.
Responsible for chairing this.
Contamos con
We
traducción
remind that we
simultánea
have
al inglés,
simultaneous
español,
interpretation into
portugués y
English,
francés.
Spanish,
Para
French, and
seleccionar el
Portuguese.
idioma de su
To
preferencia,
select the
haga
language
clic
of your
en el
choice,
icono del
click
rebote
on the
rojo que aparece en la
third
barra de herramientas
icon at the
de Zoom
bottom
y
of
elija el
the
idioma
Zoom
deseado.
and choose your
Good
language of
afternoon to all
choice.
present. My name is Isabel Duré. I am an international PAHO consultant for the virtual campus, and I'm responsible for moderating this activity. Please know that simultaneous interpretation is available in English, Spanish, Portuguese, and French. To select your preferred language, click on the globe icon in the Zoom toolbar and choose your desired language. Luego de esta pequeña aclaración,
After
damos
this
comienzo
brief
a este
presentation,
webinar
we are going to begin our
de la
webinar
colaboración
for the
del
presentation
Campo
of the
Virtual de la Organización
cooperation between the Virtual
Mundial de la
Campus
Salud
of the
y
Pan
la
American Health Organization and the
Mundial de la Salud.
WHO
Voy a pasar la palabra
Academy.
al doctor
And I'm
James
going to give the floor to Dr.
director del
James
Departamento de
Fitzgerald,
Sistemas
Director
y
of the
Servicios de Salud de la OPS,
Health Systems
quien
and
nos dará
Services
la
of
bienvenida
PAHO, who's going to say the welcoming remarks and speak of the objectives of the meeting. Dr. Fitzgerald, you have the
Thanks so
floor.
much, Isabel. A very good morning and good afternoon to you all. As the Director of the Department of Health Systems and Services at the Pan American Health Organization, it really is a pleasure and an honor for me to open this webinar on the collaborative framework between the PAHO Virtual Campus and WHO Academy. Our special thanks to our PAHO Assistant Director, Dr. Rhonda Seeley Thomas, who will provide us more detail on the strategic importance of this agreement for our two organizations. And of course, Dr. David Achuarena, who is the Director at WHO Academy, who will inform us on the perspectives for collaboration between PAHO, WHO, the PAHO Virtual Campus, and our countries in the future. And a special note of thanks and recognition to the Vice Minister of Health of Colombia and our representatives from Brazil, United States, and Argentina that will be actively engaged and participating in this event. And of course, to all of you present here that will be participating and engaged actively in our discussions. The PAHO Virtual Campus for Public Health has really shown itself to be a powerful tool for technical cooperation in the Americas, integrating educational initiatives with a broader technical cooperation action from the organization. Its educational model focuses on transforming practices by encouraging reflection on everyday challenges faced by our health professionals. We at PAHO really take pride in the evolution of the PAHO Virtual Campus over the years as a cornerstone for training health professionals in the region of the Americas. It's 22 years ago now, it's 20 years ago now that strategic decisions were made to utilize free and open source software platforms, learning management systems, and ensure that the virtual campus courses became open public goods. Our commitment as an organization to offering these courses as open educational resources has really enabled the repurposing of materials in other training projects, maximizing their impact in health in the Americas. Since 2014, we have really invested at the technological and managerial level in the PAHO virtual campus, making significant improvements in service quality and sustainability. We have ensured the migration of servers to cloud-based infrastructure, the development of technological services, incorporating massive self-paced learning courses, adopting measures to improve training quality, establishing framework agreements with regional academic institutions that really constitute the foundation for the PAHO Virtual Campus. And of course, we've introduced a business model to ensure that we can ensure the costs associated with the organization and management remain at a level that are highly manageable, and that will ensure that these courses continue to be offered free to the user. And so to today's webinar. What we'd like to present for you today really is the policy and experience of the PAHO virtual education platform through the campus, the objectives and priorities of WHO Academy, and the progress being made by the campus in recent years and the challenges being faced by PAHO in the continued expansion of the campus. With WHO Academy, we really want to highlight for you important opportunities for cooperation projects that will be developed in partnership with the PAHO Virtual Campus and shared by representatives of Ministries of Health and partner institutions. And so this webinar marks the beginning of an important chapter in our joint effort to strengthen the health workforce across the Americas. Let's seize this opportunity to learn from one another, exchange ideas, and envision new possibilities for collaboration. Thank you very much, and back to you, Isabel.
Thank you, James, for your introductory remarks. And now we'll offer the floor to Dr. Londa Sealy-Thomas, as Assistant Director of PAHO, who's going to talk to us about the organization perspective regarding the agreement of the PAHO Virtual Campus and the WHO Academy to strengthen education throughout life. Dr. Thomas, you have the floor.
Thank you, and good morning to my esteemed colleagues and the Director of the National Health Institute, Ministry of Health of El Salvador, Dr. Sandoval, the Executive Director of the WHO Academy, Dr. David Achoarena, representatives from the Ministries of Health of Colombia, Chile, and El Salvador, distinguished representatives from partner institutions, PAHO colleagues, guests, and friends. It's an honor to welcome you all to this important event to present the collaboration framework between the PAHO Virtual Campus for Public Health and the WHO Academy. Since its official launch in 2003, the PAHO Virtual Campus has been a pioneer in developing virtual education in public health, with over 3.5 million users from 225 countries and territories, and it has proven to be a strategic tool for technical cooperation, enabling the rapid and direct training of health workers. The PAHO Virtual Campus operates as a decentralized network of individuals, institutions, and organizations that use information and communication technologies to share open educational courses and resources on public health priorities for the region of the Americas. The principles guiding the campus align with PAHO's values of equity, excellence, solidarity, respect, and integrity. These principles guide the organization's actions in public health education, ensuring open, quality, and free training for all healthcare workers. Since 2014, we have made technological and managerial decisions to improve the services offered to the regional health workforce through the virtual campus and to promote the sustainability and growth in the number of campus users. With these decisions, the campus constituted a central piece of PAHO's response to the COVID-19 pandemic, ensuring the delivery of state-of-the-art knowledge directly to healthcare workers in our region and wider. In 2020, the PAHO Virtual Campus established an interprogrammatic governance mechanism involving all managers in the organization to identify gaps, set priorities, establish quality criteria, and propose funding sources and strategies to promote the sustainability of the campus, which is so important. Now, in 2024, we are ready to take one more important step in the development of the campus. That is establishing an agreement for collective action with the WHO Academy. The agreement with the WHO Academy will improve health workers' access to qualified training courses organized through the WHO Academy platform. We will work collectively with the Academy on course design and follow-up, as well as the consolidation of technological and pedagogical models, the maintenance of updated technical resources, the adaptation of WHO courses to the cultural context of the Americas, and the continued development of the country campus nodes. Over the past 10 years, we have shown the power of a virtual educational platform in public health and its importance in advancing public health goals in the Americas. We are so pleased with this partnership and with the support of the WHO Academy. We look forward to continuing the expansion and growth of the PAHO Virtual Campus for Public Health in the Americas to strengthen the training of our health workforce and improve the health and well-being of persons in the region of the Americas. Thank you so much for your attention. Looking forward to the rest of the webinar. Thank you.
Thank you very much, Dr. Seeley Thomas, for your regional outlook of virtual education. Our next presentation will be by Dr. David Achuarena, Executive Director of the WHO Academy, who will talk to us about the Academy's vision regarding learning throughout life for a healthier world. Dr. Achuarena, you have the floor.
Thank you, Assistant Director Rhonda Seeley Thomas, distinguished delegates, dear colleagues. First of all, I would like to say that it's a pleasure to be a part of this webinar, presenting and celebrating this collaboration framework between the PAHO Virtual Campus and the newly established WHO Academy. The WHO Academy, as you know, will be celebrating its establishment. I mean, the opening will actually take place in 1 week on the 17th of December. And it was really established to take stock of the recent changes and challenges in public health, in terms of new developments regarding NCDs, but also the continuous threat of infectious diseases, as well as the impact of climate change and AMR on the training needs for the health workforce. The WHO Academy really intends to leverage all the, I would say, most recent development in the field of lifelong learning to put them really at the service of the health sector. This means really moving towards establishing a truly continuum in lifelong learning for health workforce, to develop individualized approach in the content and in the access to training, and to facilitate the articulation of offerings between different institutions. It's important to note and to recall that the establishment of the Academy is actually part of a broader initiative, which is the so-called transformation agenda of the Director General of WHO, to make the organization more responsive, more effective, more efficient, and better shaped to actually address and support member states in the provision of health for all. When the transformation agenda was initiated, WHO conducted a consultation with member states to identify the most pressing needs. And indeed, capacity building and training emerge as a top priority for member states. And the establishment of the Academy reflects actually the outcome of this consultation and the intention of WHO to really place capacity building and training at the core of its mandate and of its activities. As I said, the official opening of the Lyon campus in France of the WHO Academy will take place next week on the 17th of December, and this will also be the official launch of our online offerings. A few words about really our vision, mission, and strategic objectives. The vision is really to provide skills and competencies for all, health workers. I mean, that's really a global mandate, but with a particular focus on low income countries. The mission is to achieve this vision is actually to develop not only content, but also to build a lifelong learning ecosystem. So to actually develop this network of institutions across regions. The strategic goal is unique. It's ready to enhance and develop learning opportunities for health and care workers globally. So it's a very focused, I would say, strategic objective, which is declined in five dimensions. First, to provide innovative learning content. Two, to provide high quality courses. So the first two objectives relate really to the, I would say, pedagogy. The third objective is to build this global learning ecosystem. We also have a very important piece of work related to quality and quality standards. This is our fourth strategic objective, to develop a quality framework for our offerings, but also more broadly for WHO work in training. And finally, also, our objective is to foster a culture of lifelong learning within WHO. The WHO Academy is also an academy for the staff of the organization. The target learners comprise different groups, but the top priority for us is to provide the learning opportunities to health and care workers. That's really the major objective for us. We will also develop activities and content for decision makers, since it's important also to improve the formulation and the implementation of public policies. We intend also to develop capacity building content and initiatives to strengthen national institutes, but provide training for the health sector at national level. Finally, we will also have initiatives in support of national efforts to promote health education for the public in general, considering that prevention is also a key element for achieving health for all. And finally, as I said, we will also develop activities, and this is already the case for our colleagues within the organization. Training delivery will actually combine different formats. I mean, first of all, self-paced learning through online provision, that will be the major form of delivery. But we will also have blended courses. Actually, we already conducted a number of courses through that model. And we will, in terms of innovation, also mobilize and promote the use of game-based learning and the use of simulation. I will return to that when I will describe the facilities in the WHO Lyon campus. Now, the courses will actually combine different resources. First of all, the courses developed by the Academy itself, but also other courses provided by WHO. So we work with our teams and colleagues in Geneva, which also will make the courses available on the Academy platform. And we are also offering access to the platform to partner organizations, either to host courses on our platform or to actually develop what we call a gateway between our platform and the platform of partner institutions. So in other words, we'll be really offering a wide landscape of courses, not only including courses by the Academy, but also giving access to a much broader menu of programs. I mentioned quality assurance as being one of the strategic objectives of the Academy. We have already established 18 quality standards that are meant to guide not only the design of courses, but also the delivery and the assessment and recognition of learning outcomes. So that's a very important element of our work, since this quality framework will also be offered to other entities within WHO and beyond among partner institutions. Localization is a point that is important to actually highlight. Of course, the courses that are being developed and provided on the platform are meant to be open for all, I would say, countries and health workers in all countries. We will have a dedicated effort and mechanism to localize actually content, not only in terms of languages. We already have the platform available in 25 languages, but also in terms of content. And I'm sure that this will, for instance, be very useful in the PAHO region in terms of, for instance, of meeting the needs, but also leveraging the knowledge of the indigenous population. Just a quick word on the technology. We heard that the experience of PAHO with the virtual campus, which is already a well-established institutions with more than 20 years now of experience. The WHO Academy is a newborn baby, and of course we will very much learn also from all the experience and build upon the achievements of the PAHO virtual campus. We have developed a learning experience platform, so it's a WHO platform that will be launched next week, and that will not only be a depository of courses, but it will be also an active tool to actually facilitate and support the engagement of learners and to guide them through the learning journey. So to do that, we have been integrating already AI enhanced tools, and this is something that we are going to further develop in the months to come. Finally, a word on the campus, again, that will be inaugurated next week. It's a very, I would say, rich facility, more than 20 training rooms, 2 distance training rooms. And I'd like maybe to stress the fact that in the basement, we have developed a simulation center that will, using all the, I would say, advanced technology to be able to train not only health workers, but also decision makers to actually better respond to health crisis. So this is something that we're going to demonstrate, I think, for the first time, in fact, next week. So to conclude, I would just like to stress the fact that although we are based in Lyon, the Academy of the WHO is, of course, an academy for member states, in their entirety. So it's an institution open to the world. And to do that, we will, of course, need to develop partnerships with key institutions in member states and close collaboration with our regional officers, in particular, as we are describing today with PAHO for the Americas. Thank you very much.
Thank you very much, Dr. Arena, for this important concept on education throughout a lifetime, and to talk about the objectives and the important educational aspects of the Academy. We've heard strength and the institutional involvement that the Pan American Health Organization as well as the World Health Organization have regarding health workers' education. Now it's time for the head of the Public Health Virtual Campus Program, Mr. Litowski, who's going to talk to us about the campus work in recent weeks. Gabriel, you have the floor. And he's muted. Good morning to all. We lost your presentation. There you go. Good morning to all of you. Special greetings from the city of Brasilia in Brazil, where I am at this time. I would like to thank Dr. Rhonda Seeley Thomas's word, the Assistant Director of the Pan American Health Organization, as well as the opening remarks of Dr. James Fitzgerald, speaking of our campus, and also our special gratitude to Dr. David Achorena and all the WHO Academy team for this opportunity to share this launching that the WHO Academy is doing with work that we're involving ourselves in. Very quickly, to reinforce the mission of our virtual campus as a collaborative effort among member states and other partners of the academic and institutions working in the region of the Americas, promoting training and development of competencies among the human resource and health in the region. The virtual campus is a public good, working in lifelong learning. All our educational resources are open, interoperable, following the UNESCO perspective. We have a broad field of articulation with the global WHO Academy, and we're daily betting on collaborative and sustainable work. The virtual campus of the organization since 2020 has had institutional governance chaired by our assistant director with the participation of all the directors of the organization, offering guidance, directionality, thoughts on interprogrammatic work, and a strong focus on the training needs of our country. In this field of governance, we've already had 216 proposals approved, and it guides us and coordinates the everyday work at the virtual campus. As Dr. Fitzgerald mentioned, by December of 2024, the campus has already 3 million users enrolled in more than 7,000 million courses. All the colleagues who have been to the campus looked for others. The primary healthcare physicians and nurses are an important number of persons in the campus, but also important growth amongst technicians and students in all areas. In 2024, we've exceeded the number of new colleagues visiting the campus compared to 2023 or 2022, exceeding the worst moments of the virtuality at the time of the pandemic. All of this with a strong focus on the training needs in the smaller countries, in the priority countries of our region, special attention given to the language differences as well as the cultural differences in our region. This is an example from Colombia, from whom we'll hear in a few minutes, to reinforce the fact that our work is linked totally to services, focusing, as you see here, that in Colombia, we're working on geo-referencing the campus user in the municipality he works in and with better health where he's working, so that one can quickly offer harmonization between training and health services. Our work in the countries, as we said, is of a priority nature, considering the needs of each country. So we hear from Colombia, from El Salvador, and from Chile, who are going to talk to us about some of the working models and examples of the excellent work that we've been having, the different agreements we've signed recently. In fact, we signed an agreement with Peru, and every day, more and more are joining. All this within the framework of the educational approach of the campus, which prioritizes harmonization between the work and educational problems on site of the adults in the work site, the adult resolving the realities of the work, and in the lifelong learning perspective, where there's going to be a lot of harmonization with the WHO Academy. They spoke of the learning pathways, and we're working on 4 here in our virtual campus: primary health care, better care initiatives for non-communicable diseases, regulatory authorities of medications and technologies, and digital health. A lot of joint work, hoping that the training itinerary will give the participants an overview with micro-referencing, focusing on competencies in their work site. And I'll end by showing the samples of campus certificates with the signature of our director and the digital badges so that our colleagues can share. We have 3 institutions in the region that we're working with now, strengthening teaching competencies, improving instructional design, and strategic data analysis for decision making. Thank you very much. And Isabella, back to you.
Gracias, Gabriel, por esta visión rápida y abarcativa de la trayectoria del campus y de las últimas novedades.
Very succinct overview, and also for giving us updates on many of these initiatives. Currently, now we've invited some representatives from the member states in the region and our country offices. So we're going to hear some experiences from Chile, Colombia, and El Salvador. So we'd like to thank the country offices and government officials from Chile, Colombia for the efforts undertaken. So let's begin with the Vice Minister of Social Projections from Colombia, Dr. Luis Macices Arariaga. We can start off with the video as an introduction. Good morning. Special greetings to everyone on behalf of the Ministry of Health and Social Protection in Colombia. We're going to discuss the Colombian healthcare system training and looking at the key focus. What is the central role in terms of developing human talent? This is a key question that comes to mind. What do you consider are the essential factors in order to manage this series of changes? Well, this, I think, slide summarizes the entire challenge that the country is dealing with, and actually it goes back several decades. Today, we see this window of opportunity with a progressive government that is providing us with a possibility in making greater strides in these fundamental efforts to preserve our right to health care. So we're looking at our main focus area is to provide the public protection as well as a unique, universal, efficient, and solidarity healthcare, ensuring that right. So we're going from the current healthcare system to a new social security system. The current one is based on individual insurance and governments. Well, in this case, the government uses payroll taxes and other taxes that include funding for paying for these premiums, healthcare and health insurance premiums. So, of course, there are multiple barriers to access with this system. We have an emphasis mainly in hospital emergency care. This is based between competition among various healthcare providers. It's segmented based on the capacity to pay by patients with multiple barriers to access to healthcare. So now we're going to transition to this new system, which is individual, family, and community-based healthcare, working with economic and social determinants. And the cycle of care is based on cooperation amongst the various stakeholders. We have these networks, integrated networks among various healthcare jurisdictions, so that we can ultimately ensure universal healthcare coverage. So this is the transition phase that we have seen over the last 3 decades. We've seen a separation of many of our workforce in having coverage. We've seen a systematic exposure and vulnerability. So for many, working with the Pan American Health Organization, we have established over the last 2 years a new transition plan that has been reinforced thanks to the efforts of various stakeholders to deconflict a lot of the healthcare access flows. We delegated, well, many of these responsibilities had been delegated to the market in providing social services. And it didn't ultimately play out that way. So we're looking at strengthening the role of the state and at the same time strengthening healthcare and protecting the lives of our citizens. And this is done by strengthening the capacity of the system to respond, implementing plans where we manage these comprehensive systems, where we see we've increased the cost efficiencies and profitability, but at the same time supporting the needs of our society. Our focus now is looking at more preventive emphasis, preventive medicine emphasis. So we have distributed the network throughout the entire country, working with the local communities so that we can address needs and do them in a timely fashion. We've developed a series of incentives so that we have transitioned from competition between the stakeholders, and we've been able to integrate these various triggers, and we are working in an affirmative fashion to strengthen governance as we manage the healthcare system based on articulation in the health jurisdictions. We have the Andalusian School of Public Health, working with Pan American Health Organization and the various ministries, and 11 subnational or local governments, 11 out of 32. Hopefully, we're going to ensure that all of the local governments will be able to be fully involved. So we're looking at the change management strategy focused on preparing the country to better address the transition to a guaranteed universal healthcare system based on the primary health initiative, working with the national as well as local authorities. We're moving also toward strengthening our strategic communication plans in this transition process to improve the performance of the healthcare system, strengthening the capabilities. And to do that, we first developed this diagnostic study to see exactly how we can promote these lines of effort, the ensuring greater access, distribution of our healthcare resources and talent, so that we can more meaningfully contribute to personal and professional development goals. So this key goal in our transition and evolution process, especially in the area of providing training and skills and competencies. We know that transformation starts with people, and we need to generate and accelerate change to expand to larger groups of professionals. Thanks to this virtual campus node from the Pan American Health Organization in Colombia, this has been a key support mechanism for implementing the strategy in training, and we have 3 key overarching projects. Over 8,000 people are now being trained in this ongoing program. We have what we know as the Accelerator Project, which we've discussed already, but also we're looking at strengthening competencies in primary health care, known also as educating our territories, where we're looking at this new stakeholder, the EPS, which has a high level of participation in the program, And we also have the Territorial Management in Healthcare Training Program in Colombia. This is all going to be an important linchpin in accelerating the healthcare programs where we can ultimately assure the right to healthcare of all of our citizens. That's all I had. Thank you. Well, we'd like to thank the Vice Minister, Minister Parilla, just describing how the healthcare system in Colombia and the virtual campus is addressing many of the complexities and challenges in healthcare in that country. I would now like to offer the floor to Dr. Sandoval, Director of the National Institutes of Health of El Salvador, also working in the research in developing human resources and competencies. So there's been a signing of a new agreement with launching the virtual campus in El Salvador. Dr. Sandoval, we can now begin with your presentation. Good morning. Cordial greetings to everyone. So we're looking now at the El Salvador node with our public health virtual campus. It's a pleasure to address you this morning. So the experience of the campus has been very interesting. And thanks to the PAHO country office support, we created a team and we later signed in 2022 the proposed agreement. This was consolidated and we officially established the country node with the National Institute of Health of El Salvador. After legal and international relations consultations, the signing took place at the end of 2023, as was already mentioned, and we saw a combination of many multidisciplinary efforts that led to efforts by the Ministry of Public Health with its various and key components. Just to mention the Directorate of Non-Communicable Diseases, Directorate of Epidemiology, National Directorate of the First Level of Healthcare, Medical Health Unit, and we also had local country representatives, VCPH regional team, Ministry of Education. We signed 8 cooperation agreements with various advanced studies centers and higher education institutions. All of these efforts were planned within the organization and with its efforts coordinating with the Ministry of Health, the Office of Knowledge Management was also a key component. So looking at the educational training needs, we conducted an in-depth study to determine exactly what they were. We actually had a survey distributed among 1,760 respondents. The training needs were focused mainly, according to the results, on administration and management of obstetric care. We identified gaps in training human resources and healthcare and services. It's also important to mention that as part of our efforts, we have the Public Health, Nutrition, and Research, INS 2023, developing competencies in nutrition research and also addressing many gaps this year. And we have taught 2 courses related to writing scientific articles in the health sciences and publication in index journals in 2024, and HEARTS. These are some of the most successful strategies undertaken within the country. Now, projections at the VCPH node in El Salvador includes presentation of results, present scientific evidence of training needs to decision maker, generation of partnerships, in the building of courses appropriate to the country's needs, education networks to promote an education network for health professionals through the virtual campus, scientific publications, sharing experiences and methodologies through scientific publications, as well as course development efforts. dealing with scientific communication, case reports, and narrative reviews, comprehensive mental health care for first levels of care, as well as those resulting from specific needs that we are exploring with these surveys. So thank you very much for your attention. We're very pleased to be a part of the process. Thank you, Minister Sandoval, and thank you for joining us today in this discussion. So we've seen the significant efforts undertaken by El Salvador in bringing together and articulating these efforts, as well as identifying some of the key needs in terms of training your human resources. Well, it's a pleasure. I'm very pleased with the support provided by the local PAHO country office in helping move forward with this initiative. Now we have Dr. Juan Francisco Basibalupe from the Ministry of Health of Chile. And we have a video that from the node that discusses exactly some of the characteristics of these efforts and initiatives.
Estimadas y estimados, es un honor dirigirme a ustedes como un ex coordinador, tutor y estudiante también de cursos del Campus Virtual de Salud Pública Nodo Chile. Una herramienta que desde su creación ha transformado la manera en que se capacita y fortalece las capacidades de los profesionales de la salud pública en nuestro país. Hoy, desde mi posición en el Ministerio de Salud, quiero destacar cómo esta plataforma ha permitido enfrentar los desafíos de nuestro sistema de salud, marcado por una alta rotación de profesionales, la necesidad constante de actualización y las crecientes demandas de una población en evolución. El Nodo Chile del Campus Virtual de Salud Pública ha demostrado ser un motor clave para el desarrollo de competencias en salud pública. Durante la pandemia del COVID-19, sobre todo, se consolidó como una plataforma de rápida adaptación a las necesidades de nuestro país. Se destaca por su accesibilidad universal y su enfoque en la equidad, eliminando barreras geográficas, económicas y sociales. Es una plataforma que no solo va a formar a los profesionales de la salud, sino que también los empodera, permitiendo que de todas las regiones de nuestro país, desde zonas súper aisladas hasta las más urbanas, puedan adquirir herramientas prácticas y teóricas para mejorar su desempeño. El campus virtual ha permitido algo fundamental: instalar capacidades de manera sostenible en un sistema de salud dinámico. A través de cursos personalizados y adaptados a cada realidad local, como los enfocados en salud intercultural o en el modelo de atención integral, hemos podido responder a los desafíos de la salud pública con pertinencia cultural y técnica también. Considero que el Nodo Chile del Campus Virtual de Salud Pública tiene muchas potencialidades, pudiendo diversificar la oferta educativa con temáticas emergentes y de relevancia para la salud pública. El campus no solo es una herramienta educativa, es un pilar estratégico para construir un sistema de salud más robusto, equitativo y preparado para los desafíos del futuro. Desde mi experiencia, desde la docencia y la gestión, puedo afirmar que contar con una plataforma como esta no es solo un lujo, sino una necesidad para avanzar hacia un sistema de salud inclusivo y sostenible. Sigamos fortaleciendo esta red, sigamos fortaleciendo el campus Nodo Chile, porque invertir en formación es sin duda invertir en el bienestar de toda la población. Un gran saludo y muchas gracias.
Bueno, estos tres testimonios dan
Thank
cuenta
you.
de la diversidad de
So I think the
adaptaciones y propuestas
three
que
speakers have shown some of the
para que puedan
major
responder a
efforts
las
undertaken
necesidades
in
de
the
salud
virtual
que
campus
están
arena
en
throughout the
los que
area
trabajamos en la región.
in the region. We
Bueno, a continuación
now
vamos a también tener
will
otro bloque de experiencias, pero en este caso
move
vamos a
on to
escuchar
discuss
experiencias
another
regionales
set of
de cooperación en
experiences
las
looking
líderes
at
de las
cooperation
instituciones socias. Del
in the
Laboratorio de
partner
Innovación Tecnológica
organizations.
en Salud
So
de la
starting off
Universidad Federal de Río
with
Grande del Norte en Brasil,
the
un video de su director,
Federal
Ana
University of Northern
la
Brazil,
Asociación de Escuelas y Programas
the
de Salud Pública de
Association
Estados
of
Unidos, ASPPH,
Schools
representada por
of
su
the United
presidenta, la
States.
doctora Laura Magaña,
We
y
have
de la
Dr. Laura
Universidad del
Magaña,
Hospital Italiano de
and
Buenos Aires,
from the
Argentina,
Italian
en un video
Hospital
en que el
of
rector
Buenos Aires.
doctor Marcelo Figareira,
We'll see
la
a
doctora
video
Marta Lavenheim,
that
relatan su experiencia de
discusses
cooperación con el campus
the
virtual. Vamos a
experiences in
comenzar
working in
escuchando el
cooperation with
video
the
de
virtual
países entre
campus. So let's
colaboradores
begin with our
regionales.
first video.
Agradecemos al doctor
Would
Valentín
like to
por grabar
thank
el video.
Dr.
Colegas del
Valentin
campus, por favor,
for providing us with this initial virtual campus presentation. I know Francisco has joined us. Thank you, Francisco, for this video.
Olá a todos, eu sou Ricardo Valentim, diretor executivo do Laboratório de Inovação Tecnológica
I
e
am
Saúde
Ricardo Valentim of the Innovation Laboratory of the University of the North.
OMS. O Laboratório de Inovação
This is
Tecnológica
a
e Saúde
technology laboratory working with northern Brazil. We have our university hospital in Natal and Rio Grande do Norte that is located in the northeastern region of Brazil, known for its beautiful beaches. And this is based on its acronym, the University of Northern Brazil Laboratory. One of the key areas of effort in the laboratory is the constant ongoing health education. Through projects, research developed in that area, we're able to develop in 2015, between 2015 and 2016, a virtual learning environment in healthcare. That tool, which is fantastic, that currently has 1.3 million students from throughout the region in Brazil and some regions around the world. This offers more than 460 courses, more than 12,000 online hours of courses, and we have a healthcare course that addresses many crises, including microcephaly, that we saw starting, well, this started with 2014's response. And during the pandemic of COVID-19, we created this research team where we've been able to provide translation to the course on COVID-19 with regards to emergent respiratory viruses. So this is one of the key tools that we use in promoting public health policies in Brazil. There's a lot of things we can discuss regarding the laboratories in health innovations, but I think we'll have other opportunities, and I can assure you that we have a lot more to contribute with the working with colleagues from other institutions and coordinating these efforts with the campus, with Gabriel and Isabel, and I'd just like to convey warm greetings to all. Well, we would like to thank our colleagues from Brazil for that video. We know that we have many other representatives that were responsible for that we'd like to thank you as well. Now we're going to move on to the Global Network for Public Health. We'd like to thank you for joining us. The floor is yours.
Isabel, I just want to say that it has been truly an honor and a great pleasure to partner with PAHO Virtual Campus during all these years in our shared commitment really to strengthen the public health workforce of the Americas. So thank you for having me here today. We have developed in collaboration, like really through innovative programs hosted, of course, in the virtual campus. Our partnership has made significant strides in building the region's health workforce, elevating public health capability, and modernizing the health systems. Through ASPPH, which is the Association of Schools of Programs of Public Health, which we have 160 schools with us here in the States, but in 7 other countries as well. But we also have the presidency of the Global Network. We represent more than 500 schools of public health around the world. So thank you for inviting us to be really partners of this endeavor. By uniting really our strengths, our organizations and these collaborations has equipped public health professionals with the skills to tackle critical health challenges and adapt to shifting public health priorities. So just for the time, I will just highlight 3 of our many initiatives that we have put together during all those years. First of all, I would like to talk a little bit about the ambitious program that we have that we call the Epidemiology in the Americas project to address the pressing need for local capacity building in applied epidemiology across the region. This collaboration focuses on strengthening the quantitative and analytical skills of health services and refining epidemiological practices. Central to this initiative is the creation of a 4-tier e-learning curriculum tailored to address varying levels of expertise: introductory, basic, intermediate, and advanced. The curriculum employs modular, self-paced learning to accommodate diverse learning needs and professional schedules. It equips public health professionals with hands-on skills in vital areas such as epidemiological methods, outbreak management, health surveillance, biostatistics, data science, and more. The introduction of epidemiology in the Americas course was launched in October 22, is hosted in the campus, the virtual campus, and has been highly successful with more than 25,000 learners enrolled, and also 50% of them have already earned their certification, demonstrating both the demand for and the effectiveness of the course. The basic epidemiology for health systems in the Americas course is ready for release, and the intermediate course is under development. So this unique project is distinguished not only by its broad and bilingual accessibility, but also by its focus on applied epidemiology tailored to the diverse public health needs of the Americas. This initiative plays a crucial role in strengthening the region's epidemiological workforce, ensuring participants are well equipped to address current and future health challenges in their communities. Number two, another initiative that I would like to highlight is a Telehealth Training Center initiative, hosted also on the virtual campus of public health from PAHO, focuses on integrating telehealth into primary care to drive the digital transformation of health systems across the Americas. Targeting critical areas such as the prevention, diagnosis, and treatment of non-communicable diseases, the program has achieved significant milestones. To date, the program has certified 33,000 Spanish-speaking professionals, showcasing its wide reach and impact. Leveraging simulation models, the initiative also builds resilience in post-pandemic healthcare systems, ensuring professionals are better equipped to meet evolving healthcare demands. To ensure high-quality telehealth services, we identify key competency domains for healthcare workers, including ethics, technology, public health, and socio-community aspects. These competencies are crucial for addressing health inequities in non-communicable disease care. Additionally, the virtual campus further supports telehealth professionals through self-assessment tools that help guide their ongoing professional development. And I would like to really end by the number three, which we're very proud of, is our latest and inédit initiative, which is the regional framework of competencies for teaching public health. This ASPPH PAHO's virtual campus initiative brought together 123 academic institutions from the Americas, experts from 19 different countries, to develop this regional framework. The framework encompasses 10 domains and 40 competencies, meticulously crafted through 9 collaborative stages to standardize and elevate public health education across the region. Key achievements include 2023 publication of the framework and a pilot of its tool involving 145 educators from 56 institutions across 20 countries. This year, the framework was translated into English, French, and Portuguese, and a second pilot engaged at more than 1,000 educators from 81 institutions, also in 25 countries. So in addition, an academic network of over 100 professors from public health schools across the Americas has been established, providing an invaluable resource for the campus and fostering collaboration among educators. Future plans aim to establish a network of institutions to further advance and implement this transformative framework. This project marks a significant step in ensuring that our faculty and mentors are equipped to teach in competency-based models. Through these initiatives, we advance innovative public health solutions while fostering resilience and equity across the Americas. These efforts in epidemiology, telehealth, digital health, and teaching competencies have not only addressed demanding health challenges, but also reinforced the virtual campus mission to advance public health education, collaboration, and innovation across the Americas. By empowering public health professionals and fostering a culture of learning and adaptability, we are shaping a healthier, more equitable future for the region. So we celebrate the establishment of this current alliance between PAHO Virtual Campus and WH Academy. And just to reiterate that ASPPH and the Global Network, we are here ready to join you and partner with you in this endeavor to really strengthen the workforce of the Americas and the world. Thank you and congratulations.
Muchas gracias, Laura, por
Thank you, Laura, for highlighting these points of work and the convergence between the virtual campus and the World Academy. And to end this block, we're going to hear the video kindly sent to us by the Italian University Hospital of Buenos Aires. Can you start the video, please?
Muy buenos días, soy Marcelo Figari, rector honorario de la Universidad.
Marcelo Figari, honorary teacher of the University Hospital of Buenos Aires. We want to make a brief presentation of our university and the relationship with the Pan American Health Organization. The hospital university in Buenos Aires is over 25 years with a broad basis in graduate and postgraduate courses and continuous education. And during the pandemic in October 2020, through an agreement established between our university and PAHO, we were able to implement an important program on virtual platform-based education from the virtual campus in health of PAHO. That first training program, which is in October of 2020, and the name speaks of it, to build a plane during the flight, trying to give an example of the challenge of the institutional management during the pandemic. We had important philosophers like Dr. Magaña, very well known by all of you, from the Association of Schools and Public Health Programs headquarters in Washington, and Dr. Pilar Navarro Perez from the Andalusa School of Public Health. We had then a second meeting in November of that same year with the topic of triage in education, trying to analyze decision-making, which are so difficult in times of crisis and post-crisis. Our agreement was once again reinforced in February of 2021 with a second memorandum of understanding to talk about training of human resources in development and with partners from the PAHO people with two projects. One, which was the preparation of self-training material for the design, implementation, and evaluation of education, virtual education proposals, and the second, training of leaders, which Dr. Lattingham will explain in a minute. The first of the projects is free, available through the virtual campus, has elements that include the role of the tutor and facilitator in education, evaluation instruments, learning through virtual platforms, training programs, and effective use of education applications in all formats. I'd like to ask Dr. Lattingham to talk to us about our experience with the leadership course. Doctor? Thank you, Marcelo. Yes, the second course, as he mentioned, was a course for educational management in health organizations, developed for 2 years, including a meeting with leaders from the region to think of the need to train in leadership and manager required by those who lead education in our region at this time. And we thought that this type of management and leadership courses was so important because they face changing and complex situations, and they require space to think about the possible practices using the available theory frameworks. And it's important for us to have an ethic. That's why it was geared to those who do this type of work in different environments. We had a group of professionals from different countries, Argentina, Uruguay, Colombia, and Brazil, and with the presence of participants from 19 countries of Latin America and the Caribbean. It was a very, very interesting course, and it had a great deal of discussion. Proposal was a completely virtual proposal with synchronic and asynchronous opportunities, proposing at all times recovery of the experience using a conceptual framework to favor the collaborative work, generating a portfolio where each participant spoke of his own experiences and how these were changed within their own context and based on a theoretical framework, where throughout the course we developed the different domains of leadership in education. And we want to share that we recently participated in a workshop prepared by the Virtual Public Health Campus in Panama, working on the management of educational quality, showing our commitment to continue to work with the campus, not only in the development of quality proposals, but in building the actual criteria required for educational quality in the region and what are the challenges to reach this and to ensure it. Thank you very much. Thank you, Roberta. And we believe that this clearly shows our joint commitment with PAHO. Thank you.
Marcelo, Roberta, muchas gracias a ustedes y al equipo
Marcelo and Roberta, thank you very much
por su trabajo. Bueno, creo que
for your presentation and your work. I think that these two presentations show the variety of the virtual campus on permanent education and lifelong education and the training of public health actors. It's a proof of the quality of the organizations in the region. And the last presentation for this group, it's a little late, but we thank you for your patience. We are going to list Javier Litowski and Charina regarding the plans for the future and things that are already developing within the framework of this promising agreement.
Gabriel, David, thank you. And in the interest of time, I'm going to try to be quick. Here, as you can see, there's a series of bullet points that reflect the agreements that have already been signed and cooperation mechanisms in the following areas. We're looking at the development of outputs and products with special emphasis on regional academic institutions in Spanish and Portuguese to ensure interoperability among the platforms so that health workers in the region will be able to freely circulate between platforms. Also providing mutual recognition and accreditation for emergency medicine responses, working together, as was already shown in the Italian hospital example, to provide tutoring opportunities and virtual training. So this is the learning pathway that we're embarking on jointly. And let's take a look at some efforts that are already in progress. Dr. Anchorena talked about the quality standards. We have the virtual campus working actively with the support of the WHO Academy aimed at quality standards promotion, and we've also seen focus on these gateway to PAHO courses so that we're able to present within the WHO Academy some of the core courses offered by PAHO. We see how the organization's campus maintains a presence in this gateway developed jointly with the technical staff from the WHO. We're going to continue these collaborative efforts with the three institutions that have already given presentations this morning. And in 2025, we hope that we will be able to work together with both technical teams. Dr. Serena, if you would like to add anything to this.
David, you are here?
Sí, muchas gracias, Gabriel. Thank you very much for those points, reflecting really the consensus and the convergence of forces between the PAHO Virtual Campus and the WHO Academy. I would like to stress the fact that the basic principles that provide the foundation for the work of the PAHO Virtual Campus are very similar to the ones that guide really the work of the WHO Academy. Open access, providing and developing a global public good. I mean, those are the fundamental principles also that the WHO Academy intends to serve. Building learning pathways for health workers and providing a quality assured framework that will also allow for certification, recognition of learning, including through the issuing of digital badges. So, I mean, a lot of the work that has been already conducted by the virtual campus will be, I would say, further reinforced, but will also guide the activities of the WHO Academy. So partnerships for us is a key word, and we are really very pleased to have been able to develop this constructive, really, framework with the PAHO virtual campus. And through that, we will be able also to link with a number of institutions in the region. Some of them have actually already expressed their experience today, and we are looking forward to also develop partnerships with more. In terms of a collaboration with member states, I think that the models that have been established through the so-called NODES and Chile and El Salvador, they also provide a very interesting model in terms of collaboration with member states, not only to expand access to learning, but also to contextualize content. And I think that the work for localization that the WHO Academy will put in place will also, be a very important instrument to ensure the relevance of delivery. And with the help and support of the virtual campus, we will also ensure that the WHO Academy will further provide, I would say, relevant content that will actually add to what is already available on the virtual campus. So I'm very pleased, and I'm sure that with this collaboration, we'll be able to actually further reinforce really access to lifelong learning in the region, in the health sector, in a way that will support countries in the achievement of their policy goals to provide global health for all and to provide universal health coverage. Thanks again, and again, we are very much looking forward now to the implementation of this framework with the virtual campus, with member states in the region, and with partner institutions.
Muchas gracias a ambos. Bueno, hemos llegado al final, hemos realizado
Thanks to both of you. We have made a real overview of all the institutions and the possibilities that we have to strengthen this agreement. So thank you to all of you. And to end this webinar, I would like to give the floor once again to Dr. James Fitzgerald. James?
Thank you. Thank you so much, Isabel. Many thanks to you for moderating what has really been an amazing session. Over the last hour, I think we've really heard of the great work that is ongoing through WHO Academy and through the PAHO Virtual Campus. And what we've really seen, I think, is the importance of online education platforms in developing the necessary capacity within health systems in our countries, from Colombia, from a substantive health sector reform process, to El Salvador through capacity building in multidisciplinary needs, and management and administration, as well as quality improvement processes and clinical service delivery. Chile in public health capacities during COVID-19, and indeed from our wonderful partners in Brazil with AvaSUS, with Laura, with the ASPPH, and key universities such as the Universidad Hospital Italiano de Buenos Aires. No? So, David, we're really excited to join forces with you, WHO Academy, to take, as our Assistant Director, Dr. Celia Thomas noted, education and training of the health workforce in the Americas to a whole other level. Jointly with WHO, we commit to expand capacity and increase the knowledge base in the Americas to respond to current and future needs of the health workforce and of the population. So my thanks to you, David, and all your team in WHO. My thanks to you, Gabrielle, and all the team at the virtual campus. We're really excited for this collaboration. We hope everyone connected here will continue to join us on this journey. And we look forward to keeping you all informed of the advances we will be making as we move forward with implementation. Isabel, many thanks to you again. My thanks and regards. A good day to you all. Bye-bye.
Bueno, muchas
Thank you very
gracias a
much.
todos.
Bye-bye.
Bye-bye. Thank you.
Así damos por
Thank
finalizado.
you. Goodbye.
Bye-bye.
Thank you very much. Thank you.
Thank you all.
Virtual de Salud Pública es la plataforma educativa de la Organización Panamericana de la Salud. Su objetivo es contribuir al desarrollo de las capacidades y competencias de los trabajadores de salud a través de la cooperación técnica, apoyando la transformación de los servicios y acercando el conocimiento a la práctica de salud pública en la región de las Américas. Miles de trabajadores y estudiantes de ciencias de la salud de toda América están aprendiendo y actualizándose con cursos y recursos de alta calidad del campus virtual, en forma gratuita y en 4 idiomas. El campus virtual cuenta con cursos